So patients often ask, well, when should I have my knee replaced? And generally, for a knee replacement, you should wait until you have arthritis that is limiting your everyday life substantially. So you're having trouble, you're changing your activities based on the knee arthritis. You're having trouble with sleeping at night. Your knee is giving way and you think, I'm going to fall because of my knee. That's when it's time to start considering knee replacement. That and having failed conservative treatments for knee arthritis. The conservative treatments for knee arthritis that don't involve surgery, the mainstays are cortisone injections and physical therapy. There are other injections like platelet-rich plasma, stem cells, hyaluronic acid, the so-called gel injections, and bracing that are all fine to try, but they haven't shown the same effectiveness as just regular old cortisone shots and physical therapy. And so that's typically where we start with patients. When patients think of knee replacement, they often are under the impression that knee replacement involves removing the knee bones and replacing a large portion of the bones with metal. In fact, this is an actual knee replacement here, and knee replacement involves metal caps on the ends of the bones. And so on the femur or thigh bone, there is a metal cap that's about 10 millimeters in thickness. On the tibia bone, there's a metal cap that's about 10 millimeters in thickness. And then in between those two metal caps is a high-strength plastic bumper or insert that absorbs the impact that you get with everyday life. And so knee replacement is a lot like capping a tooth, but just on a big scale. And those are the actual implants that we use during the surgery. The biggest risks of knee replacement in the United States are infection and problems with motion, either stiffness or instability. All these are really rare. We have a very regimented, highly regimented program at St. Joe's and at the surgical centers to keep those complications from happening. The big way that we avoid infection is making sure that people are optimized for surgery in terms of their weight and diabetes management, essentially. And the big way that we avoid problems with motion postoperatively is making sure that they're set up for therapy and participate in the therapy after the knee replacement surgery. So after knee replacement surgery, patients do not have any restrictions in the activities that they do. So for instance, can you go back to sports and things like that? Yeah, absolutely. There may be sports that you feel that you can't do because of the knee replacement, but you don't have any restrictions as far as what sports you go back to. To give you some numbers, overall, when you ask patients who have had a knee replacement, what is your knee replacement relative to an 18-year-old's knee, they'll tell you, my knee replacement is about 80% of an 18-year-old's knee, if that gives you an idea of the level of function that you're eventually able to expect. So it's not a perfect knee, but it's worlds better than what most people start off with prior to surgery. So many patients have been told that a knee replacement only lasts about 10 to 15 years, and that's actually no longer true. The modern knee replacement materials have a 1% per year failure rate. So after 20 years, you have a 20% chance of having the knee redone. And so they actually last a pretty long time. The biggest advance has been the geometry of the knee replacement components and the material constitution of the plastic insert that goes in between the metal parts. So many patients are fearful about the type of pain that they're going to have after the knee replacement. And physical therapy after knee replacement is tough. There's no two ways about it. But the pain control around the time of knee replacement is much better than it used to be. It's tolerable now, whereas it used to be pretty severe. The main changes have been the more use of spinal anesthetics around the time of surgery, which sets you up for less pain throughout the entire recovery period. And then we also, within the past 10 or 15 years, have been placing nerve blocks around the knee at the time of surgery, and that really limits the amount of pain that patients have postoperatively. And it turns it from something that was, unbearable to something that's tolerable. After the tough physical therapy, patients come back and we say, well, was all that worth doing? And they say, yeah, it sure was. In the end, it was a tough process, but it was worth getting the knee replaced and going through all that.